Good day, everyone. I am Christine, the moderator for this webinar. I welcome everyone to today's webinar, Navigating FDA Inspections Successfully, Most Common Observation and Prevention Strategies. I would like to introduce our presenter for today, Meredith L. Crabtree. Meredith L. Crabtree is a regulatory compliance and quality systems expert with over 30 years of hands-on experience in FDA-regulated industries, including pharmaceuticals, medical devices, biologics, dietary supplements, cosmetics, and animal health. I would now like to hand over the floor to the speaker. Over to you, Meredith.
Thank you, Christine. Welcome everyone to today's session. As she indicated, today we're going to talk about navigating FDA inspection successfully. Most importantly, we're going to talk about some of the most common observations that are seen during an FDA inspection and some of the prevention strategies that you can take. So the agenda for today, real quick, again, we're going to have an FDA inspection process and some of the common observations. So we're going to understand FDA inspections and some of their regulatory expectations. We're going to decode the FDA 483 process and the establishment inspection report. And then we're going to talk about observation type 1, 2, and 3. Basically, we're going to go through 6 different observation types and then develop a culture of compliance and continuous improvement. So first, let's have an understanding of the FDA inspections and the regulatory expectation. What is the FDA? The U.S. FDA is the U.S. Food and Drug Administration. It's the federal agency within the Department of Health and Human Services. So why does the FDA conduct FDA inspections? So what inspectors evaluate? So enforcement tools that are at the FDA's disposal. So now let's get back to that form 483. What is a 483? So what is the establishment inspection report? So now let's talk about the top observations and how to prevent them. So the first one that we have is inadequate documentation and record keeping. So documentation deficiencies are among the most cited issues during any FDA inspection. So some FDA expectations for documentation. So what does the FDA look for in documentation? The FDA also expects companies to follow a range of good documentation practices that goes beyond these foundational concepts. So some common examples of GMP documentation errors, but why documentation matters from a compliance and product safety perspective. So some key points for documentation. So some final thoughts on documentation. So now observation type number 2 is employee training deficiencies. Employee training deficiencies are also a common root cause behind many FDA Form 483 observations. FDA expectations for training programs. So what the FDA looks for in training programs. Some preventive measures and best practices. Create a training program that's built on 3 pillars. So a few final thoughts on training. Our third observation type is failure to follow SOPs. SOPs are our backbone to any consistent and compliant operation in our FDA regulated industry. FDA's expectation for SOP compliant. So what does the FDA look for in SOP execution? So prevention measures and best practices. Some key points here. So final thoughts on SOPs. Observation type 4, CAPA deficiencies and root cause investigations. And typically this is lack of CAPA investigations. You know, what FDA expects, when they're looking at our CAPA system. So what the FDA looks for in corrective and preventive actions and root cause analysis. Good CAPA versus bad CAPA. A good CAPA of this exact same situation, some preventive measures and best practices. So embedding preventive thinking across our QMS. Anatomy of a strong CAPA. A cautionary reminder. So CAPA timelines and follow expectations. So some final thoughts on CAPA. So lastly, let's talk about facility and equipment failures. Facility and equipment related issues are a significant focus during FDA inspections. FDA expectations for facilities and equipment. So what the FDA looks for in facility and equipment oversight. Preventive maintenance and best practices. Environmental monitoring citations are common in sterile manufacturing. So some proactive maintenance strategies for compliance. So some final thoughts on facilities and equipment, developing a culture of compliance and continuous improvement. Attribute to a high compliance organization, the role of leadership, quality monitoring should become embedded into your operations rather than an external check. Compliance should also be viewed not just as a destination, but as a byproduct of a healthy culture. We should also have accountability at all levels. Training beyond compliance, cross-functional collaboration, use of quality data in decision making. So now, a few final thoughts for culture compliance and continuous improvement. As a wrap up, I want to pause and reflect on one of the most important mindset shifts in quality systems. Thank you. Again, thank you all for your time today. Hopefully I was able to touch on some of the most critical FDA 483 observations.
Thank you, Meredith. That concludes the session for today. Thank you everyone for participating. You may all disconnect now and have a great day.
Thank you.